Afternoon. Welcome, everyone. I'm Lori Tucker. I'm one of the pediatric rheumatologists at the BC Children's Hospital in Vancouver, and I'm also a Cassie Friends board member. I'm really excited to be here today with a terrific group of Canadian pediatric rheumatologists and all of you to connect around rare childhood rheumatic diseases in our community. Next slide. This is really an amazing day, and we're excited to have everybody with us. We had 105 people from 67 cities who registered to be on this event, and from 7 countries. Pretty amazing. You can introduce yourselves in the chat box and tell us where you're joining us from, or your child's diagnosis, or your child's age, as a way of getting better connected. Next slide. For those of you who are new to the Cassie and Friends community, I'd like to tell you a little about us. We are a parent and patient-led organization that works hand in hand with pediatric rheumatology teams and researchers across the country. We are the only organization in Canada that is 100% focused on kids and families affected by juvenile arthritis and other rheumatic diseases. And our vision is a pain-free future for kids with arthritis and rheumatic diseases. Our event today is a very special one. We will have 4 sessions running concurrently on lupus, dermatomyositis, vasculitis, and fever syndromes. In those sessions, you will hear from a pediatric rheumatologist who's an expert in a specific area, and you'll have the opportunity to ask questions during the live question and answer period. I feel this is a really unique opportunity. My colleagues are internationally recognized experts in these diseases and have so much experience in caring for children just like yours. Bringing together patients and families from across the country and around the world is also a great opportunity for you to learn and connect. A few housekeeping notes. You can keep your cameras on, but please mute your mics during the presentations to avoid disruption. There are dial-in numbers that were available in the registration email or the reminder email that you received yesterday in case you have technical difficulties. When it is time to move into the breakout rooms, you will click to get into the breakout rooms, and I'll give you a little more instructions towards the end. Next slide. In the next 5 to 10 minutes, I will do a little introduction on the overall topic of rare rheumatic diseases in childhood by talking about what is a rare disease, how do we define it, what are these diseases that we're talking about today. You have joined this session because you or your child have one of these diseases, but I thought you might be interested to know what these other diseases are. And lastly, I'm going to talk a little bit about the similarities across these diseases. Next slide. There are many rare diseases in this world. Rare gems, rare chemical elements, wonderful rare wine, rare steak, and rare animals like this very rare white giraffe. But what do we mean when we say rare disease? Next slide. The official Canadian definition of rare disease is one that affects fewer than 5 out of 10,000 people. These diseases we're talking about: dermatomyositis, lupus, vasculitis, and periodic fever syndromes all qualify as rare diseases. Next slide. To put this into some sort of perspective, I ask you to consider the average Canadian high school. So here in Vancouver, the average Canadian high school has about 1,500 kids. You might consider how many children in an average high school have, let's say, a disease like juvenile arthritis. You would see 2 to 3 kids in the average high school. Lupus, you might see 1 kid in the average high school of that size. Juvenile dermatomyositis is more rare and might only be seen 1 kid in every 2 to 3 schools. Vasculitis is even more rare, with 1 kid maybe in 4 schools. Periodic fever syndromes are more difficult to quantify in this way. We actually have less information about exactly how often they occur, but the rare genetic periodic fever syndromes are said to occur 1 to 2 per million people. I want to tell you that these numbers are somewhat general, and this is one big problem we have. We can't even tell you or government with accuracy how many kids actually have these diseases, how often they occur, and if they are actually more frequent in some places in Canada as compared to others. Next slide. You are all aware of the consequences of having a child with a rare rheumatic disease or being a patient with one. It's hard for families to find information about their child's disease. Most people have not ever met anyone with the disease or have ever heard of it. This includes your family, your child's teachers, soccer coach, and other parents. Community healthcare providers who you rely on may have a lot less experience with this problem. And the end result is kids and families may feel quite alone on their journey. Next slide. I'm going to spend a very brief moment to describe the rare diseases we're discussing today. In the breakout rooms, the experts are going to expand on these, but I thought you might want to know something about the diseases that you or your child don't have. I've listed only a few facts about each disease. Systemic lupus erythematosus is also called lupus or SLE. It is more common in girls and women and people of color, and symptoms can include fevers, rashes, arthritis, particularly inflammation in the kidney or other organs. Juvenile dermatomyositis, or JDM, is a disease of inflammation of skin and muscles. Children can have generalized weakness that can be mild, ranging to very severe. Vasculitis is a disease of inflammation of blood vessels and often occurs involving kidneys, other organs, and skin. There are many types of vasculitis. Periodic fever syndromes are classified by having recurrent episodes of unprovoked inflammation, usually with fever. Next slide. Although these rare inflammatory diseases seem quite different, in fact, there are many similarities. Next slide. So if you look on the side where it says what's different, these diseases do affect different immune pathways. They may have different ways of affecting the body. So they may affect the skin and the muscles primarily, or kidneys or lungs or brain. There may be differences in how long it takes to get a diagnosis. For example, most children with lupus, dermatomyositis, or vasculitis may become very sick with fevers and rashes and high blood pressure and severe muscle weakness. This will bring them to medical attention and often a diagnosis relatively quickly. In contrast, many children with fever syndromes have recurring episodes of unexplained fevers for months to years before they're recognized and correctly diagnosed. But there are many important similarities. All of these diseases involve activation of the immune system. The principles of how we evaluate patients are pretty similar. These diseases are chronic diseases lasting years in many instances. The worry and isolation of kids and parents with these diseases are quite universal. Many patients with rare rheumatic diseases have a team of physicians involved. The rheumatologist, the nephrologist or kidney doctor, a cardiologist, a dermatologist, a neurologist, as well as allied health personnel. And many of you use similar treatments, and you may not recognize that. These medications are listed here, but they're used in a number of these rare rheumatic diseases. Next slide. What do we hope you gain from attending today? Well, I hope that you learn some new things about your disease from these Canadian experts. I hope you meet another patient or parent and leave feeling less isolated and feeling a connection to a community. We would really like to build a stronger community in rare diseases for all of you through Cassie and Friends. Next slide. I'd like to introduce you to my colleagues who will be presenting today. Dr. Adam Huber from Halifax, Dr. Marinka Twilt from Calgary, Dr. David Cabral from Vancouver, and Dr. Deborah Levy from Toronto. You will learn a little bit more about their backgrounds from the moderators once you're in your groups. I have to tell you that these people are